The screen is yours.
Well, good morning, and it's a huge honour to be here in Nottingham today to address the Maternity and Midwifery Festival for the Midlands. I'm delighted to be here to speak at today's conference on breaking the taboo and the challenge of birth trauma. Let me start by saying thank you to all of you who work in the NHS, and in particular midwives and NHS maternity professionals for all that you do. I was the chair of the Birth Trauma Inquiry in the UK Parliament, and I'm delighted to deliver today's keynote address on our findings and to share some lessons from my book, Breaking the Taboo. The stories that I will share today, including my own and those of many other families, I should say, are shocking. But I do think it's important that we continue to discuss the findings of this landmark inquiry, the first in British history to be undertaken by a cross-party committee of MPs. So even if it is hard to hear, I think we must learn the lessons from the many families that bravely gave evidence to us. And I should say that it does include families who also live here in Nottingham, and many of those who gave evidence to Donna Ockenden. And she has written the foreword to my book. So today I want to talk about why improving maternity care matters, but also 1 year on from our report, to call on the new government to listen to mothers and to implement in full the recommendations in our report. The new Prime Minister and the Health Secretary must ensure that no mother faces a postcode lottery with their perinatal care. But sadly, that is what we heard very clearly in both the written and oral evidence to our inquiry, but also in the stories that I've included in Breaking the Taboo. And I think as midwives and healthcare professionals, you are all here to hopefully be part of the change and to deliver some of the findings in our important report. And that's what I'm here today to ask you to do. Before I delve into the details of the report, let me start by sharing why tackling birth trauma is deeply personal to me and why I've written a book about it. When I gave birth to my daughter over 2 years ago, I had very little understanding of the risks in childbirth or the potential chance of sustaining a birth injury from a vaginal birth or developing post-traumatic stress disorder. However, after a grueling induction process and a 40-hour labour, I ended up bleeding very heavily after delivery when my daughter finally arrived. I had imagined that first golden hour where she would magically crawl up my chest and I would start breastfeeding. Instead, I was separated from my daughter and rushed into emergency surgery. I went through 2 hours awake on the operating table and without a general anaesthetic due to my earlier epidural. And I remember the trolley knocking into the walls as they wheeled me into theatre and being slid onto the operating table. I'll be honest, it was the most terrifying experience of my life. I genuinely thought that I was going to die. At the time, I had no idea that I had sustained a third-degree tear and that I would be unable to properly look after my newborn baby. And this was despite attending antenatal classes and reading about childbirth in advance. Nothing had prepared me for that experience. And sadly, like many mothers, I continue to live with the consequences, both physically, but also psychologically, from my own traumatic birth. I was lucky to have been referred to specialist perineal clinic in Staffordshire and also to access mental health services. And it was later when I met some other mothers through the Birth Trauma Association and when reading the many submissions to the Birth Trauma Inquiry that unfortunately I discovered that my experience was not uncommon. And if you want to read in a lot more detail about my experience, you can read it in Breaking the Taboo, but also the stories of other affected families. And I've included chapters on maternal mental health, birth injuries, lockdown babies and COVID-19, but also importantly to hear from dads and fathers. And my husband has written his story down for the first time. I think it's important that we listen to them too. So let me talk about the scale of the problem. We estimate that around 30,000 women every year are suffering from a traumatic birth, although I do think that this data is an underestimate. And the physical consequences of birth trauma can be life-changing, most especially living with bladder or bowel incontinence as I myself have experienced, as I describe in detail in my memoir. I've been struck over the last 2 years since my national campaign was launched to improve maternity care in the UK and reduce birth trauma, that talking about difficult experiences in childbirth still seems to be a taboo subject. And that begs the very important question of why is it that the challenges and risks associated with childbirth are not being widely or publicly discussed in this country. So I hope if there's one immediate result from me very publicly sharing my speech and breaking down in the chamber of the House of Commons, and by leading this cross-party inquiry, that we have finally started a national conversation on birth trauma. And I hope that I've helped to break the stigma and the shame of talking about birth trauma. That's why I decided to lead a debate on it in Parliament a year and a half ago, and that's why I think our inquiry is so important. And I hope that the lessons that we found are going to be acted on by the government and the NHS to improve maternity care across the country. Ministers need to take action to ensure that we remember that there are two patients, the mother and the baby, and that their physical and mental well-being is just as important as that of the child. I was quite shocked to discover during my campaign the very high levels of costly litigation in maternity. I would much rather we reduce the risks in the first place and spend it on a properly funded NHS workforce. And I've been repeatedly asking the government to deliver safe care by prioritising and investing in all of you to make sure we have the frontline services that we need. I also find it very concerning that estimates show that around 40,000 mothers did not return to work, owing to poor maternity provisions offered by their employers. So we know that this is an issue which is affecting also the wider British economy. I'd like to set out now some background to the inquiry and some of our key findings, but also how the previous government has responded so far to our recommendations. I set up the first All Party Parliamentary Group with my co-chair, Rosie Duffield MP, as the first cross-party committee in Westminster specifically dedicated to birth trauma. When we launched the call for evidence, we were inundated with members of the public, and we received submissions from over 1,300 families and also medical experts. I chaired 7 public inquiry sessions in Parliament, where we heard from experts, but also families and mothers directly affected by birth trauma. And I think for parliamentarians to hear those very personal accounts of birth trauma and its impact on them and their families was incredibly powerful. But I should add, we did also hear some very positive stories. And I think we should also talk about optimism, and I hope that our inquiry report can become a roadmap for best practice at NHS trusts. And I am keen that we have good ideas which are better shared across our health service, as we need to have improved and better joined up patient care. I'd like to give a particular thanks to the Birth Trauma Association, who were the secretariat for the inquiry and also drafted our report. The report is 82 pages, so I'm sure many of you haven't read the whole thing cover to cover. So I just wanted to set out what some of the key findings were. And it is a sobering read. Our headline finding was that there were serious failings in maternity care across the UK. And I'd just like to point out now some of the key themes that were identified, in the hope that you can all be part of the change that we'd like to see. Firstly, we heard from families that there had been a failure to listen. Many mothers informed us that their concerns had been brushed off. This was true both pre- and post-labour. The usual response to concerns was to say the mother is being unduly anxious. One mother called repeatedly for a scan because her bump's height had dropped 8 centimetres and she was ignored. Her baby had undiagnosed restricted growth and died during labour. Secondly, we heard about a lack of informed consent. Many women were not informed that they were at risk of particular birth-related issues. One example of this was a woman who was told that she had a bicornuate uterus, but was not informed that this put her at risk of a premature birth. She sadly went into labour at 28 weeks, and her baby died shortly after birth. Women also told us that they underwent medical procedures without consenting to them, or even being told what was going on. I'm afraid I was in that category too. This included vaginal examinations and cervical sweeps, the use of forceps and C-sections, and specifically regarding caesareans, many women told us that they'd requested them and had their request denied, with one mother being laughed at when she asked for one. Thirdly, we heard about poor communication. Witnesses to the inquiry told us that they had not been informed if they had medical conditions, sometimes finding out over months after their birth. We heard from women who had their notes mixed up. And I think the worst example I heard of this came from a mother who told me that her daughter was told she could have anything from dyslexia to cerebral palsy and was then asked to discuss end-of-life care. 5 days later, her daughter died, and the hospital did not inform the health visitor. The health visitor knocked on their door and congratulated them on the birth of their daughter. And during the inquest, the hospital repeatedly got the daughter's name wrong. We also heard fourthly about a lack of pain relief. A very high proportion of submissions discussed the lack of pain relief. One mother turned down paracetamol because she did not think it was strong enough, and the midwife responded by pouring the medicine down the sink, and the mother was left writhing in agony because she was offered no alternatives. She was later denied an epidural due to her platelet count being too low, and she went through her entire birth with no painkillers, including experiencing a 3rd-degree tear. Fifthly, we heard about a lack of kindness, and the vast majority of submissions, I'm afraid to say, did refer to the lack of kindness being displayed by some professionals. We heard stories of mothers being left covered in blood and feces, hooked into catheters and unable to walk, being chastised for not feeding their babies when they were too weak to lift them to their breast. Sixthly, we heard about breastfeeding problems, with a major cause of it being trauma for women. This was primarily when women felt they were being forced to breastfeed when they could not, and for many women like myself, very weak after hemorrhaging, we simply could not express milk. Seventh, we heard about the lack of proper postnatal care. Like myself, many mothers found themselves in their bed sheets covered in blood, thinking that we were going to die, whilst being left alone. One mother told me that she was physically unable to look after her baby. She had her baby returned to her and was informed that the baby had soiled itself. But rather than assisting her, the midwives told her to deal with the baby herself. And as she struggled, she heard staff in the corridor laughing and discussing which Chinese takeaway to order. Eighth, we heard about the impacts of COVID. And as with all areas of medical practice, I know that COVID had a huge impact on maternity units. There was a very sharp rise we found in the data of mothers experiencing post-traumatic stress after birth from 2020 onwards. Mothers told us that they found themselves isolated and in fear, particularly when partners were told to leave them shortly after birth. Yet even during this time, one mother was told to, quote, stop behaving like a baby and to grow up when she expressed these concerns to her team. Ninth, we heard about complaints and medical negligence. I'm afraid to say that many mothers told us that hospitals had failed to act once birth trauma had occurred. One woman gave birth to a stillborn baby. She was informed during her pregnancy that there was nothing unusual about her baby's movement slowing, and her notes incorrectly stated that her baby was healthy. She was denied a C-section and was given a morphine injection without her consent. She later agreed to a post-mortem with the promise that both her daughter and her placenta would be analysed. She was later informed that her placenta had been thrown away due to an error. I just want you all to really reflect on those really shocking stories that I heard, and I've only given you a few examples out of over 1,000 that I read. So whilst I totally recognise that many women in the UK will experience a very good experience during childbirth, and of course this inquiry was only focused on the negative experiences, I do think those stories are shocking. I don't think they're acceptable, and that's why I've been calling on the government to effect change. And it's also something I hear time and time again from families who come on my podcast, Breaking the Taboo, is that they didn't feel listened to by NHS professionals. So please be part of that change. You are the front line and you can make such a difference to women's experiences in hospital. I'd like to turn on to the specific recommendations in the report and just outline for you the kind of 12 key headline recommendations that we gave to the government. The first was to recruit, train and retain more midwives, obstetricians and anaesthetists to ensure safe levels of staffing in maternity care, and also to provide mandatory training on trauma-informed care. To provide universal access to specialist maternal mental health services across the UK to end the postcode lottery. To offer a separate 6-week check post-delivery with a GP for all mothers, which includes separate questions for the mother's physical and mental health. To roll out and implement, underpinned by sufficient training, the OAC Care Bundle to all hospital trusts to reduce the risks of injury in childbirth. To oversee the national rollout of standardised post-birth services, such as birth reflections, to give all mothers a safe space to speak about their experiences in childbirth. To ensure better education for women on birth choices and all NHS trusts offering antenatal classes. Risks should be discussed during both antenatal classes and at the 34-week antenatal check with a midwife to ensure informed consent. Respect mothers' choices about giving birth and access to pain relief, and keep mothers together with their baby as much as possible. Provide support for fathers and ensure that the nominated birth partner is continuously informed and updated during labour and post-delivery. Provide better continuity of care and digitise mothers' health records to provide communication between primary and secondary healthcare pathways. And this must include the integration of different IT systems to ensure that notes are always shared. Committing to tackling inequalities in maternity care amongst ethnic minorities, particularly Black and Asian women. And to address this, the NHS should provide funding to each trust to maintain a pool of appropriately trained interpreters with expertise in maternity and to train NHS staff to work with these interpreters. And finally, for NIHR to commission research on the economic impacts of birth trauma and injuries, including factors such as women delaying returning to work. And if you're interested to read more about these recommendations, do read the Birth Trauma Inquiry Report in full, but I've also written a whole chapter called the Maternity Manifesto, where I talk about this in more detail with some practical recommendations. And I was pleased that last year, our official report in Parliament, the then government did respond to several of our key recommendations. The former Health Secretary agreed to my headline ask for a comprehensive national maternity strategy. They did agree to the standalone GP appointments of 6 to 8 weeks after giving birth to include crucial questions for mum and baby. And on physical injuries, they rolled out improved perinatal pelvic health services, including guidance to better support women who experience serious tears, like myself, to prevent these from happening in the first place. So that is an incredible response from our campaign, which was cross-party to try and improve maternity care for mums across the country. But I stand here today, 1 year on from that really shocking report being published, and I note that the Health Secretary has not accepted a number of the recommendations which the previous government had agreed to. And that is why I've written a book to call on the government to do so. So I'd like to say thank you to all of the families that gave evidence to our inquiry. I hope that they feel listened to and that they feel heard. I will be continuing to fight for them to have improved maternity care in the UK. I have said to the government, I don't think it's acceptable that there is a postcode lottery in this country on perinatal care. And really my call to all of you is, I don't want any mother to go through the experience that I did, or so many families in that report and in my book. So please, let's break the taboo, let's speak about birth trauma, and please, can you all be part of the change to implement these recommendations? Thank you.